Opening a health clinic for Monmouth County, New Jersey. As of 2018, Monmouth County had 627,551 people occupying it. 91.8% of people within Monmouth County have health care. Out of that 91%, 79% were public employee offered health care, 25% were public, and 8% had no health insurance, and out of that 8%, 3.8 were children. Primary care to patient ratio is 880 to 1. Preventable hospital stays were 4,188. Median household income, 91,807, with a low income population of 21,000. Within Monmouth County, health risks are 14% of adults smoke, 23% are obese, physical activity level is only at 22%, 20% excessively drink, and 28 alcohol impaired driving deaths have occurred. The investments, patient goal per day would be 32 patients seen within the clinic. That would equal 11,680 patients per year. The annual healthcare costs would cost $275,000 with an annual healthcare revenue of $350,400 based on an average of $30 copay per patient. The clinic will be open from 7 days a week, Sunday through Saturday, from 7 a.m. to 9 p.m. Now there are challenges which managing investments with the changing laws, expansion of healthcare access, and growing patient demands, needs to access change, and needs to more financial resources. The pressure to cut costs while boosting outcomes puts restrictions on how much money can be spent to improve the patient's health. Adjusting to the market focus, new medical technology is being developed and can always take advantage of its benefits, whether it's due to high costs or outdated IT structure. But the implementation of a new clinic would result in the newest and latest technology and staying compliant with healthcare regulations. Healthcare providers have to make sure they're compliant with a number of rules and regulations governing everything from patient privacy to outcomes. Cutting corners in this can land facilities in bad situations, so having funds available from different investments will help keep compliance up. And the solutions for these tactics are use an alternative source of funding. Looking into different methods of paying for services, such as leasing equipment or renting the equipment. Bundling services to save on total costs, such as software and service costs, using unified systems, using the same vendors as hospitals, and sharing resources with the hospitals and healthcare providers, working together as a healthcare community. It is critical to consider a variety of elements, so there'll be several options for the facility to cover its financial responsibilities, from value-based payments to market pressure and technology. You can see here that the opening of a clinic in Monmouth County will be greatly desired by the community, as they are a high-risk community with very risky behaviors, with only 6 hospitals within driving distance.